And our last speaker for this session is not, as billed, Margaret Wilcox, the President of the Association of Directors of Social Services, but in fact Glen Garrod, who is the current Vice President and will be the Association's President in the year to come. So I'm very pleased that Glen is here with us, and we very much look forward to working with you over the coming year as well, Glen.
Thank you, Paul. Good morning, conference. Hey, I got a better response. Yes. Okay. What's wrong with that title? I think one of the things to start with is that I'd rather see technology as an opportunity to build resilience. Resilience for individuals, with families, friends, and for communities. And I think as part of this, we've got to see our current journey in social care and healthcare as one in which we're redefining the relationship between the state and the individual, but we're not expressing it terribly well. I should also point out that ADAS is responsible, and there are 152 of me in the country, which is a bit of a scary prospect, but we are responsible for some £20 billion of the public purse. And I wonder whether we're spending it well, whether we're spending it wisely, even in an age where austerity has reduced that to a level in which we are probably now operating at the margins. So, in terms of a background for social care, most of you will know this, but what was impressive to me was just how eclectic the background of colleagues in the conference is today and yesterday. We have colleagues from the fire service, from district councils, from housing providers, from healthcare providers. That range, that eclecticism for me is where the strength lies in what you can do. Social care is another eclectic range of people engaged in supporting the most vulnerable adults in our communities. Social care also touches, in England, some 1/5 of the total population. And I'm updating Philippa's figure. It's about 6.5 carers from 6.4. And that's still probably an underrepresentation. What's particularly interesting, though, is the nature of caring in that environment has increasingly meant that carers now are providing support to their loved ones for over 50 hours a week. That's dedication. And are we supporting them as well as we could? Social care is also a vital connector to other public services, especially the NHS, but also local housing and community services. But it's also interesting to point out that there are more nursing and residential beds in social care than in the NHS. They just happen to be provided by small to medium enterprises, not by large monopolistic providers. There are also more workers in social care, some 1.5 million, than in the NHS, which is operating at about 1.2 million. I think it's fair to say also that social care remains highly valued, but it is to those who are engaged in receiving it. That is despite the number of people who are no longer receiving care since 2010 because of the level of cuts that the government have imposed on people like myself. But we do need a greater level of public awareness so that social care and what it can do to transform and personalise care, support and lives has a greater public perception beyond the 1/5 of people who are currently receiving it. And it's particularly pleasing last week that we heard from David Behan in the Care Quality Commission, which talked about the improvements in social care continue to outweigh the deteriorations, despite budgetary restrictions. We are still getting better, despite what you might read in the media, or what certain ministers might talk about. But social care is a very broad church. It's important to recognise that social care providers are not the only people providing social care, alongside families and friends. In my own local system in Lincolnshire, the fire brigade is very heavily engaged in providing slips, trips and falls advice alongside fire prevention and safety checks. We have a broad church of interest, and we've got to reach out to that increasingly, which includes colleagues who are providing digital supplies and services. But if we are to be truly transformative, we have to have a stronger public narrative. That means common purpose with TSA, with ADAS, with NHSS colleagues. Good social care is valued, personal and distinctive, but it is only representative for people when they truly understand what it can do in a wider public environment. And that public narrative is not yet there. I'm not going to go through this slide in any great detail because you already know this. But one of the things that concerns me, and we've heard it from Jono earlier, is are we truly operating at scale to make a difference? Are we being truly transformative with the opportunities that digital technology presents? Bit of audience participation, if you will. Who thinks that we're sufficiently operating at scale in England using digital technology? Any hands up? No? Who thinks that we're being truly transformative? No? And I agree with you. We are still not operating at the scale to make a difference. We are still not operating in a transformative fashion that shifts the business model for how social care is provided, how social care is commissioned, and how social care, housing and healthcare services are experienced by individuals. I've already mentioned the financial context, and it's particularly depressing for someone like me that we represent some 1.2% of gross domestic product. If you go to the Netherlands, it's some 3 times that. We are increasingly going backwards as a nation in terms of the amount of GDP we spend on social care. But that reflects a very narrow perspective. It's the public purse. When we think about the privately funded social care market, we move from a £20 billion industry to 40 billion. But we rarely know or understand that private market well. But it is a large market, which increasingly means 2 in 5 in the population are engaged with it. Our digital technology opportunities also mean that we can increasingly think about our predictive capacity to meet need better, both at a population level, but also at an individual level. One of my responsibilities on the day job is public health. And my colleagues in public health are particularly excited about the opportunities for predictive epidemiological data. But we're not there yet. My fire service colleagues in Lincolnshire do not contribute to the data that I hold on social care need. I only understand half of the total population receiving social care in Lincolnshire because 50% are buying it privately. That's a missed opportunity. It's a lack of coherence in understanding what need is, where it is, and how best to support people. It's particularly important, and I think we've been hearing from colleagues earlier, that the redesign of services has to increase the pace for some of the reasons I've already outlined. When we think about reducing the public purse, but also the increasing levels of need, the increasing roles of families and friends, not only in providing support, but also funding support. It's not just private purchases of care or the public purse that provides care. It's also an operating area in the middle where people are providing top-up funds to supplement what is increasingly becoming a state-subsidised service rather than a state-funded one. But do we truly understand our customer base? Perhaps local government, national governments, national bodies aren't the right place in which we can truly understand the customer base. Some of the language I am using would horrify some of my colleagues. But we have to move into a place where we are much more open to the possibility of other organisations understanding our consumers better than we do and listening to them. This is a broad church, and we have to find common purpose. So, how will technology support a redesign of the system? And I have two scenarios for you. My personal view, that's been developed over 30 years in the sector, and also at a personal level as a carer in my own right. We allow our customers to experience the complexity of our world. We saw in Barbara's web of care the complex set of interactions because people lead complex lives. But as a consumer, where's the Amazon experience? It doesn't exist. I can't think of a single council providing social care where there is an easy access point that allows self-help, self-referral. If we also think about whether the business model allows people to self-serve, second scenario. We tend to operate like an expensive restaurant where you have to wait to be seated. And then you get a very limited menu. Well, why aren't we operating like a buffet restaurant? Here's your tray, walk down the corridor, see what you want, and pay for the goods at the end. If we think increasingly about 50% of the market is privately funded, we are not supporting that market, those consumers of those services, to access information, advice, or service in a way that makes it simple and easy. Far too often, people are reliant on personal contacts to get the information and knowledge they need. Jono talks about the number of personal interactions he had to pursue to get a minor procedure. My wife's a GP. In my hometown, she's well known because she's been in the business for about 30 years. I managed to avoid all that because I can say to the consultant that I know, Sabina reckons I need this. And lo and behold, I avoided 2 interviews with a consultant and I got straight to minor surgery. I shouldn't have to do that. But if I expand on that, how do we open a system to people self-serving in a way which reduces transaction costs and wasted time and effort on the part of limited clinical and social care time? So, think of the whole market, not just part of it. Improve public awareness. I know Paul's very supportive of this, and there is a need to expand the public narrative about where we are going and what kind of business model will work best for the population, not just of today, but of tomorrow. Find common purpose and operate at scale and help us to change our business model. You have some of the solutions. You have the ability to challenge us in our thinking, in our approach, and take us far further than we have been able to go to date. Thank you very much.